Hello. So my name is Rondario. I'm the founder and the CEO of Impact Hub Manila. So we are part of the largest network of impact-driven entrepreneurs in the world. And the reason I'm here is because we really are focused on finding solutions for many of the social ills of the world, and particularly given the situation that we have been under due to the global pandemic. It's always interesting for us to see how solutions could be adapted for the current situation that our country and the world really is experiencing. And health is going to be at the forefront of this whole new normal, if you can even call it that. And today it's going to be exciting because we are going to be talking about what safety measures could we expect and could we ideate on given this new normal as we all kind of trickle back into work, right? So I don't know about you, but I'm still letting my team stay home because a lot of them commute. So for me, this session is actually also very informative for me to understand how we could ease people back into work. And all of you who are joining us today, thank you. Keep coming in. We are joined by three very awesome panelists, and you're going to be in for a treat because they're practitioners who really do carry out how to implement structures and systems to make this whole normal be more, I guess, effective for everybody, right? Given the situation. And so I think we're okay to start. So guys, good afternoon. I'd like to first start off by introducing our panelists. First is Jozica Habijanic from, she is the Philippine country head of Roche Diagnostics. Roche is the world's largest biotech company, but truly differentiated medicals in oncology, immunology, infectious diseases, ophthalmology, and diseases of the central nervous system. Roche is also the world leader in vitro diagnostics and tissue-based cancer diagnostics, and a frontrunner in diabetes management. Josie, maybe you want to say hello to all of our audience and our guests who are joining us today.
Hi, everyone. Hello. Hello from BGC.
From my neighbor. Next panelist is Kevin Dineros. He is the founder of the Digital Medical Society of the Philippines and Vice President of Medical at Zennya Health. Kevin, he's a doctor. Dr. Kevin, alongside heading medical at Zennya, runs and has founded the Digital Medicine Society of the Philippines, which aims to be the catalyst in capturing evidence-based data in the practical application of novel digital health technologies in clinical practice and population health. Hi, Kevin.
Hi, Seth. Thank you for that generous interview. But today I'll be wearing my occupational health hat, and because we're discussing workplace health and safety. And apologies because I won't be able to share my video because I'll be using my phone for the duration of this webinar.
No problem. Good that you are going to be donning that hat because I think that's what the audience is looking to hear from. Next, David Foote, founder and CEO of Zennya Health. David is a serial entrepreneur who has founded and operated companies in the PC entertainment, enterprise business intelligence, internet security, and social networking spaces. Currently, he is the founder and CEO of Zennya, a rapidly growing mobile health platform delivering personalized healthcare services to patients. And I am an avid Zennya user. So hi, David.
Hey,
good
Seth.
afternoon.
Yep, thanks for having us here. Thanks for hosting this.
No, it's a pleasure. And I think for all of the people who are joining us today, we're all kind of interested to understand how we can, effectively move back into this new normal. So to kick it off, I would be calling you guys out and to share your insights and the things that you perceive as to how we could implement, safety measures as we go back to work. Let's start off with Josie. I'll give you the floor and I'll pass on the mic to you.
Thank you, Seth, and thanks very much for inviting me to this webinar. Looking forward. Just few disclaimers before I start. I voluntarily participate that without fees, and Roche is really working with like-minded organizations in supporting in fight against COVID and really to help improve the healthcare system. So I'm gonna share my screen, which host unfortunately disabled. We need a...
Okay, we'll fix that.
Sure.
But while we're doing that,
Yeah.
maybe we. Okay, there you go. You're ready to do that. Can you try?
Okay, thank you. Thanks very much.
Wonderful.
That's great.
Hi guys, to those who are joining.
All right. Do you maybe see my screen?
We can see it.
Okay, wonderful.
Wonderful.
All right, so today I'm really going to talk about what kind of testing is in place for COVID. Especially I'm going to focus mostly on workforce screening. And I'm going to talk also a bit about, what do you need to take care of? What do you need to watch when you're choosing the right test and the right provider for your workforce screening? So there are two types of testing solutions out there in the market. One is the test that detects virus. And these are usually PCR or antigen tests. And they will give you an answer on a question whether you're currently infected. So those tests are basically looking at active infections. And then on the other side, there are tests that detect the antibodies, basically your immune response. And when you test with those tests, you will get an answer whether you have been exposed to COVID. So it will measure your immune response in the body. One is virus, the other is immune response. So in Philippines, there are already 93 tests out there approved by FDA. 41 are PCR tests, and these tests are mostly done in the labs, in a very specialized labs, by specialized skilled personnel. It takes few days to get to result, and the costs are around 4,000 to 8,000 pesos. Depends on provider, of course. Then on the other side, there are two types of antibody tests. You have rapid tests, and this is majority of those out, 52 are rapid tests, and they look like pregnancy tests. They are tests on a cassette. They could be done on site, in your office or in the lab. The test has to be performed by medical professional, and it takes approximately 20 to 30 minutes to result. And the cost is roughly 800 to 1,500. It really depends. I'm just talking about rough figures. And then there are antibody laboratory tests, which just recently came out into the market, have been registered. There are a few of them, and they are usually done in hospital or commercial lab. What happens is usually the lab comes to to your workplace. They take samples, they take blood. It's usually done on the blood, and they collect blood from your employees, and then they bring those tubes back to the lab, and then they do testing and report result back to your HR or to employee. It takes few hours, and the cost is usually less than 1,000 pesos. So, and there's variety of tests, IgM, IgG, IgA, total. It's a lot of letters, and I'm gonna try to explain this in a simple way, in how basically the whole flow of infection goes. So when you're exposed to SARS, what happens first, the virus starts to multiply in your body. And it reaches at a certain point, a peak, and this is where basically it takes roughly 5-7 days, but there have been also 2 to 14 days until you get the symptoms. So this is roughly 7 days, and this is when your symptoms occur. And this is also what you detect with a PCR test. And with a PCR test, you will be detecting all the way up to week 4, week 5, sometimes even week 6. So, and for PCR test, what you're really detecting is active infection. So if it's positive, you have the active infection. If it's negative, you don't have an infection, or it's too early because you're detecting in before symptom onset, or it's a failure of the test. Now with antibody test, what's happening is you're developing 2 types of antibodies, IgM and IgG, and that's why you have different variety of tests for these antibodies. So what is happening after basically almost virus has disappeared out of your body, the antibodies start to appear. And the antibody starts to detect, the antibody test starts to detect immune response only roughly about 14 days after the symptoms occur. So, and what it says is, if it's positive that you have been exposed to infection, you have immune response, or if it's negative, you have not been exposed. So that means, basically, if you do antibody tests, most of the people will be already past the infection. So dilemma is for workforce screening. We are all talking about antibody tests, but there is a window here in week 1 and 2 where people are basically virulent, infectious, but we are not testing them. So it's really a testing dilemma for workforce screening, because if you really want to test and de-risk your workforce population and make sure that nobody is infectious in your workplace, means you have to test everyone almost on PCR, which is based on the cost, based on the time it takes to get result, based on the fact that you can test one day and the next day person can get infected again. It's not practical. So it's a really dilemma. In addition, you have asymptomatic people who never develop the symptoms, and it's gonna be also difficult to catch them. So that's one problem that we have at workforce screening. Another is the test quality. Usually when we talk about test quality, we talk about sensitivity and specificity. So when it comes to PCR tests, you really want to make sure that you detect the people who are infectious as early as possible. So that means you need to have very high sensitivity test, because if you don't, you will have false negatives. That means you will be releasing to workforce infectious people. When it comes to antibody test, the problem is that those tests react to a lot of different viruses, common cold viruses and others. And there are hundreds of those viruses, and a lot of tests out there are false positives, and you need to have a test with very high specificity. So we did one example. We did a simulation just to put it into practical perspective. If you have on one side test 1 with specificity of 99.8%, and we know rapid test kits, they have lower specificity around 93.8. These are good tests already. And there are also very good tests which claim to have 100% specificity. So, but a lot of tests out there are around that specificity and lower. What that means is that basically in that case, and it's just 5% difference in specificity, in the lab test 1, 97% of your results will be correct. In the test 2, only 45% of positive results are gonna be correct. That means you will have a lot of false positives. And if you test 100,000 people at 5% prevalence, it will lead up to about 6,000 people, which you will be releasing to workforce with false positive results. Means you will believe they are getting immune response, but in reality, they are not. So they are still at risk to become infected. So the quality really matters, and we know there has been a lot of unreliable rapid tests out there in the market, and a lot of countries have stopped rapid testing. Except in Philippines, there is still a belief in rapid tests. We have a lot out there. I think it's around 40. So, and Philippine Society of Microbiology and Infectious Diseases said that there are 2/3 of rapid tests are really, they are turning into false positives. So what's important really here is that you're really choosing the right rapid test and the right provider who is working with really high quality tests. This is our test. It's a laboratory test. This is our specificity and sensitivity. We have tested over 10,000 people on cross-reactivity and specificity, and we found no cross-reactivity. So this test is done in the labs, and we will be launching it in next week. And also from Roche side, we have also PCR technology, antibody testing technology, and we have also other tests for patient management. However, all these tests are performed in laboratories. All right, so at the end, to test or not to test, given all this information, is it better to have false positive test and have false positives, or it's better not to test? So I will just refer to DOH guidelines right now at the moment. They claim that the testing is not required for people with no exposure. However, you should always check the symptoms, daily temperature and symptom monitoring of all staff, and basically test all people that symptomatic people and people that had some kind of exposure. So if your population is coming out of area hotspots, it's definitely worth to test. Asymptomatic are really dangerous ones. So because you don't know, they never develop symptoms, so you never know whether they are infectious or not. That's why they also recommend to test really representative samples for baseline, to do a PCR sample and antibody-based sample testing. But to be honest, more you know really about your workforce, more testing you do, less risk you will have. So these are the guidelines. No test is ideal, to be honest, but it's better to know your workforce and know about, look at the symptoms, check them, and it's good to really do testing because you have more information about population. So that's all from my side. A bit complex, but yeah, I think we'll get there.
No, I think this was just really helpful, and I think we're all in this whole kind of confusion as to what to put out and what to prioritize. I think especially for entrepreneurs, right, for business owners, on what to do. So thank you for the overview. We'll circle back with questions later, but I'd like to give the floor now to Kevin, who, from your hat and your vantage point, what do you have to kind of share?
Sure. Let me just share my slides for a little bit.
Sure. We'll get to your questions, guys, in a bit, okay? We'll round up the presentations from the panelists, and then we'll get to your questions. Thank you for sending it in. Keep asking. I like the screensaver.
Sorry about that.
No problem.
Let me see.
I think I can go to one question. Josie, somebody's asking, does Roche currently making any tests or study about developing a medicine against COVID?
Actually, Roche was the first one that developed the test for COVID.
Yeah.
So we have both PCR testing and we have antibody testing, which I said that we are launching next week with the top laboratories, also Zennya.
Mm-hmm.
We also have drugs for severe cases. But however, we are still working on clinical studies for a specific indication for COVID.
Medicine.
For medicine, yeah. It's the drug against arthritis. So we are working and doing clinical trials for COVID indication. However, we know that it's a judgment of the doctor on how to use the drug, and I know it is used here for severe COVID.
Okay,
infection.
thank you. Hopefully we'll get some updates on that further along. But thank you for indulging the question. Kevin,
Yep.
on to
Do you guys
you.
see my slide?
Yes, we can see it.
All right, awesome. So good afternoon, everyone. I'll be discussing workplace health and safety. I'm going to approach it very generally. So we're going to do an overview so you have an idea on what organizations are expected to some degree to do during these times of COVID. So first, we'll discuss occupational health and safety. So occupational health deals with the aspects of health and safety in the workplace that has a strong focus on the prevention of hazards. So prevention is always better than cure. We always hear this, and this is true to the practice of occupational health. So in order to maintain a healthy workplace, you want to identify all the risk factors that could potentially cause harm to the employees, and you want to sort of mitigate, if possible, eliminate them, and that's the ideal setting. So a workplace hazard refers to a situation where in the workplace that has the potential to cause injury or adverse effects to people and damage to plant or equipment. So these are separated into different categories. So you have the physical work hazards, the ergonomic, chemical, biological, psychosocial, and mechanical work hazards, and we'll discuss them one at a time. So what's a physical hazard? So physical hazards are environmental factors that can harm an employee without necessarily touching them. So these are elements in the workplace that has the potential to actually cause damage. And this happens with the employee not knowing. And it's potentially dangerous. And the most common ones would be due to noise, due to radiation, and certain pressures. And the bad thing about it is that it doesn't really damage the body acutely. So it doesn't happen in a single day. The damage doesn't occur in a week. It occurs very chronically, meaning you'll see the symptoms after a few months or even years. Next is the ergonomic hazard. This is very, very common in the workplace. So the posture, if you have awkward postures, if you do certain movements that are repetitive, that are straining your body, straining your muscles, it's not good for you in general. It can cause harm to your body. And this the common complaints of all the workers that have poor ergonomics is muscle pain. So that's very common in your clinic, and you would see that everywhere. Next hazard would be chemical hazards. These are hazardous substances that can cause harm. These could be in liquid form. These hazards can result in both health and physical impacts, such as skin irritation, respiratory system irritation if you inhale it, blindness, corrosion, and explosions. So these are more common in laboratory settings, industries that involve chemicals, handling of chemicals, packaging of chemicals. It's very common in those industries. Next topic of hazard of interest is biological hazard. It's very interesting because this is what we are currently facing at the moment due to COVID. So biological byproducts or compounds that can cause adverse health impacts. So included there is the bacteria and viruses, animal bread droppings, fungi or mold, and blood and other bodily fluids. That's why In a laboratory setting or healthcare setting, it's you're required to actually dispose of blood products properly in order to prevent biological spread, biological hazard spread. Next, psychosocial hazard. So this is very often overlooked. However, due to the present mental health law, there's some light that's shed onto it. So it's psychological issues arising in the workplace that can cause mental distress, emotional distress to the employees. And some of the examples would be harassment, could be an overabundance of stress in the workplace. There's some violence or victimization. And then this really does cause an impact on the employee health and well-being. Lastly is safety hazards. So these are most common and will present in the workplace. For example, these are wires that are not hidden properly. These are machines that are not maintained well. So those are the hazards that could cause the general safety hazards. Working from heights also is included in the list. So with regards to legislation, the Department of Labor and Employment sort of strengthened the act in creating a healthy workplace for the employees. And that's due to the Department Order 198-18. So this is what we're trying to comply with. And it includes a range of parameters. So you want to have, they require you to have policies. They require you to promote mental health, promote HIV awareness, make sure you have good standards in the workplace. You have appropriate signs. I won't elaborate or dive deep into it, but I'll discuss the salient features that is expected on the employee and the employer. So the roles of the employer. So it's important for an employer to create a hazard-free workplace. That's a big responsibility. You have to give complete job safety instruction and orientation to all workers. As per DOLE, 8 hours is required to orient the workers into the various aspects of health-related issues in the workplace. You inform the workers of the hazards associated with the work. So, and then you equip them with the necessary tools and preventive measures so that the hazard doesn't take its toll on the body of the employee. You use only approved devices and equipment for the workplace. Of course, you comply with OSH standards, and this includes the reporting of accidents and injury. You allow workers and their safety and health representatives to participate actively in the process of developing a health program. So this is very important, especially for me, because you want to involve your employees in terms of creating maybe a policy or a protocol, because they're the ones who's going to be using that and they're going to be involved in it, and it's better to get their perspective on it. Lastly, the employer should provide measures to deal with emergencies and accidents, including first aid arrangements. So this is a referral system, and you'll see how this ties down to the current recommendations of DOH and DOLE for COVID, wherein it's required, but employers are required to actually have a referral process from the workplace to the hospital in case there's a suspect, COVID suspect. Next is the role of employees. So it's the law is not one-sided. So there's also an expectation with the employees, and that is to participate in ensuring compliance with OSH standards in the workplace. The employer may provide the fees if the employees do not use it right or take that for granted, don't even use it because it's uncomfortable for them. Then it's pointless to actually implement those safety measures. Next, they make sure that all safeguards and safety devices are in order. They have the right to report any defects, observe prescribed steps in case of emergency. That is the importance of educating the employee prior to hiring them or getting them started in the workplace. They need to know the emergency measures in place. They could report to the supervisor any work hazard that may be discovered in the workplace. So they're the eyes and the ears of the supervisors. They have that responsibility to actually report it. If there's any takeaway from this short lecture of mine, this is what I want you to take away. The hierarchy of controls. So this is how occupational health practitioners look at hazards and how to deal with hazards, right? So starting from the most effective to least effective, you control a hazard by either eliminating them, substituting, applying engineering controls, applying administrative controls, or giving out PPEs. And we will discuss this one at a time. So in our approach to an existing hazard, let's say, for example, COVID, the first step is to know what we're dealing with. So here we know that we are facing a biological hazard. We know that it spreads via air droplets.
Started, you know, Governor.
Yeah. Hello?
Go ahead. Yeah, we hear you. Go ahead.
Okay. All right. So we know we're facing a biological hazard. We know it's spread via air droplet. We know that there's high risk for people who have more comorbidities such as hypertension, diabetes. We are not prepared to deal with on the scale, and I'm pretty sure that the DOH and Dole we're not prepared, so we're caught off guard because of this. There's a shift in work environment which requires thorough review and revision of existing corporate health and safety policies. So what you had in your company or in your organization beforehand, right now pretty much it's you need to revise it. You need to look at it again. There's some issues that are not addressed by those old policies, and of course there needs to be a balance between operations and safety. I know safety is priority, and that's why we had the quarantine, and that's to prevent or eliminate the spread of disease by non-contact. However, what suffers in the long term is our economy. So that's why we need to start jump-starting it and applying those safety measures properly in our workplaces and handle it responsibly so we can jump-start the economy.
Right.
So steps to take. So pretty much we're at the resilience to return to work phase at the moment. Returning to work means you create a detailed plan to return to work. And of course, you prevent the spread of COVID accordingly. And I think that's a good position to be in. It's a good time to actually revisit old policies and apply new guidelines. And the businesses need to sort of evolve and adapt to what is expected to be the new norm. All right, so the hierarchy of controls, the goal is to minimize risk. So the first hierarchy of control is elimination. So it speaks for itself. It's a control strategy based on completely removing a material or process causing a hazard. And then what we did and what the government did for us is that they closed everything, right? So that's complete elimination of a hazard, a potential person going to a workplace and spreading the disease. However, it's the most effective measure, yes. But in a sense, if you need to go back to work, if you need to jumpstart the economy, then we really can't implement this forever, right? So because the economy will suffer. So what we try to do is look at the next best thing. So we look at possibly substituting. So in terms of what is occurring today, substituting is applying the normal work process, which is, let's say, returning to work, and sort of adding onto it and making it a bit more stricter, adding a bit more layers onto the protocols so that you prevent the spread of disease. So one such example of this would be like a COVID immune pass, if you heard about this, wherein they expect that people be, some people be tested, some people answer a survey every day, and that is actually mandated by Dole, that we do an employee screening on a daily basis. And those are the things that you could do to actually strengthen your return to work process. Next is the engineering controls. So engineering controls is something that you actually build or integrate into the facility that could lessen the spread of the hazard. So one such engineering control that is applicable in times of COVID would be something like a disinfection booth. So there are some companies abroad, in Korea, I believe, and in China, wherein they installed an infection control booth, a sanitation booth, in front of their buildings. So the employees have to undergo disinfection process, and then that's when they're going to be able to enter the facility. Another measure could be there's going to be cameras that are infrared. This is more high tech, and this would detect any individual that has a high temperature. Very important, administrative controls, although it's in the lower end. However, I believe this ties down everything in the hierarchy of controls, because if there's no administrative support, then there's no implementation or proper implementation. So I discussed with you the education part, some strategies of managers that they did in times of COVID is that they do shifting work. Sometimes they sort of ask, it actually depends on the company. Sometimes they ask them to do testing. Sometimes they pick those who are high risk and tell them to stay and work from home still. Some companies even adapted completely, and they're working from home 100%, and they're able to be functional. So administrative control is still very important. Last but not least, this is what we wear every day when we go out, personal protective equipment. This is the least effective. However, it still protects us and on a personal basis, and it's still valuable to us. So these are your face masks, face shields, goggles, or gloves. So each company, this slide, I don't want you to digest too much of it, but I want you to know that each company has a different strategy. And the strategies actually depend on the company's capacity and the way the company operates. So that's very important to know, capacity and then the way the company operates. So what we get as recommendations from the DOLE and DOH, these are all recommendations. And these are recommendations because this sets the foundation on how we create our own process internally sa company natin. So some companies, what they did, a couple of examples here is remote working. I discussed work and shift planning, hygiene and health. They do disinfection. That's after certain intervals of the day. And lastly, they have a good referral and communication system. So that's pretty much my takeaway with the issues with regards to workplace hazards in COVID. So that's it on my behalf. Thank you.
Thank you, Kevin. I think I was going to follow up with the question on the current, how it connects to a lot of the governmental regulations, but I think you touched on it on your presentation, and I'm trying to be sensitive of time. So as you were mentioning earlier that the measures that we give are tailor fit to the company, right? And so I think to kind of move along the conversation, I'd like to ask David, so what's Zennya? How is Zennya attacking and approaching this whole situation? I mean, I know that you have a company of more than of people, and so wondering what you guys are doing and the strategies that you're putting in place.
Sure. So, Seth, we're approaching it as a technology company. We're first approaching technology, and since we're healthcare technology, we're approaching it with health tech. So, what we're doing for our own providers is we're doing a combination of online daily screens. We're screening them in terms of taking their vitals and steps. We're immunizing them with the 2020 flu shot, which I can talk about later as well. We're doing rapid COVID testing with them, and we're doing temperature checks daily. So we're sort of combining all these data points into one holistic view of their health. Yeah. And as we prepare to launch some of our services, whether they're nursing services in the home or wellness services, we're going to make sure that all the providers that we send out have all these data points in place so that we are putting our best foot forward to make sure that we're sending someone out that's not infected and not going to infect.
Right.
And I'll cover some of that in a little bit more detail in the presentation.
Okay, I'm happy to see it now. Over to you. Would love to see more into the strategy, because I'm sure we have entrepreneurs on the call in the audience, and I'm sure everybody's wondering how they could apply certain things also in their company. So.
Okay, is the screen sharing working?
Yeah, it is.
Okay, great. So David Foote, I'm the CEO of Zennya. This is a photo of what I used to look like before COVID. Now my COVID hair hiding under my hat.
We all need like a photo, COVID-19 photo, yeah. Official photo.
So the focus of my presentation is going to be on managing COVID health risks. So it sort of says to tee up what you just said. It's really going to be about how do we do it and how do companies do it. And also I want to address the health risks from both from a corporate standpoint as well as from a healthcare standpoint. So to start off back to like where we started, why did we lock down to begin with? The initial intent was to flatten the curve, and what that meant is that we wanted to delay the spread of COVID to buy time to increase capacity of the healthcare system to be able to address the people who became symptomatic. The question of like now 2 or 3 months into it, did we succeed? We don't really know. I think that the testing has not been significant enough to give us enough data points to be able to have good visibility into whether or not we've actually flattened the curve. In fact, the curve actually is not flat. So if you look at the infection rate that we've had, it has been continuing to sort of go at a steady rate. The good news is the transmission is not accelerating from what we can tell. But the bad news is we have really limited information that we need to carry with us to go back. And economically, I don't think we can stay locked down much longer. It's just you have to balance the health risk of COVID versus the health risks that come from not seeing doctors, for example, or from lack of economic pressures that are causing people to not engage in regular activities. In fact, I think medical activities in general down by almost 80 to 90%, and that's going to have a lot of cascading effects we're going to have to deal with for years. So now we're looking at returning to work. So it's all about risk management, right? Is we have to go back. We know that we don't have a lot of information. So it's how do we manage the risks behind returning to work? And so to take a step back and look at it first, who's at risk here? The first population, I think a lot of people know this risk, are the elderly. The good news in the Philippines is that's a relatively small portion of the population. Less than 4% of the entire population is 65 and over. So the most at-risk group by age is really just not present in large numbers here, right? They are the highest risk of mortality. If you look at mortality risk for COVID, you see the sharp increase from 60 and above, it's that elder group. But the advice here is you got to keep them at home and have them lay low until this thing blows over. But now let's talk about the young, and I'll go back and point out that that's around 30-40% of the population. They're super spreaders, right? And the reason why the young are super spreaders is that they're generally asymptomatic. The COVID has such a mild effect on the young that it's very difficult to tell whether or not they actually are infected. In fact, in one study in Israel, something like 33% of all the COVID cases for children under 10 had no discernible symptoms, right? They didn't have fever, they didn't have cough, but they were still spreading. And the other thing is, children are highly interactive with each other, low hygiene in terms of how they, they're not conscious about these things. So again, I think the advice for some time now is keep them at home as well, right? Not so much for their health safety risk, but from a spreading risk. So that brings us to office workers, the people coming back to work, and the risk here really for them is pre-existing conditions. And in fact, I didn't have time to update the slide, but another report just came out that says the absolute #1 pre-existing condition to look out for is obesity, right? Which is actually fairly prevalent in the Philippines. And so if there's one health issue that puts you more at risk of having, not of catching it, but of having adverse reactions when you do catch it, of being highly at risk, it is obesity. So it really brings the healthcare focus in terms of how we have to look at who we protect with when we bring people back to the workforce. Next, that is diabetes and sort of other chronic care conditions. So now in terms of the stats, 1 in 4 Filipinos are obese, right? So this is affecting a fairly large portion of the population. And then another factor is Filipinos have low physical activity almost regardless of purpose. And this data comes from AXA Life. What this means is whether it's work-related, travel-related, or leisure-related, as a culture, people here don't engage in a lot of activity, which goes back to, sort of physical fitness and health. And COVID is really attacking that issue. The people that are most at risk are the people who are the least physically active and the most obese, right? So it's really something, it's a time to have increased awareness of healthcare and how it affects not only ability to work, but ability to sort of navigate in this post-COVID environment. 1 in 4 Filipinos are hypertensive, so that's another pre-existing risk factor. And again, the reason for these numbers, they often relate. If you're obese, you're often hypertensive, and these things are sort of related factors. Nearly 50% of all Filipinos in early adulthood have higher than normal blood pressure. And the reason I'm focusing a lot on this is Zenya's been engaged with a number of companies dealing with COVID testing and back to work factors. What we've seen is that there's a fairly low level of interest in pre-existing health conditions, a lot of interest in testing. And I think that sort of misses the point. They're both important. We have to look at not only testing people in terms of being asymptomatic, but if people do come in and do catch it, who's at highest risk of having adverse reactions? So another factor to share here is that the people with the highest chances of being diabetic and obese are rich, urban, college-educated females. So this, in terms of the demographics, if we're looking at the back-to-work scenario, this is a large portion of back-to-work. But yeah, this data is all from AXA Life, from the data report that they did. Mm-hmm. So it's sort of counterintuitive, actually. The people that are most at risk here are the well-to-do office workers, right? That's the segment we actually need to be worrying about. So, managing risk. We've maybe heard this: screening, testing, tracking, and tracing. In terms of screening, we're looking at screening for pre-existing health conditions, and this can be done through questionnaires. It can be done through blood pressure, body fat composition, blood tests, and then testing. Josie talked about this a little bit. There's rapid tests, there's PCR tests, and there's also daily symptom checking as a form of testing to make sure that people are not symptomatic coming in. Then tracking and tracing has to really do with either contact tracing using technology or contact tracing using call centers and contact centers to try to figure out who was infected and isolate. So one point to get across here, an important point that I want to focus on, is COVID risk management. It's healthcare related and it's very complicated. So I'm sharing here a slide from one of the companies we're working with, one of our current clients, Conception Inc., who's done, we think, an excellent job of looking at their back to work protocols. And I'm just going to walk through it really quickly to show you the complexity of what they're dealing with. Number one, they start off with, bring the mouse over here. They start off with having their employees do a return to work checklist to see what sort of pre-existing conditions, have they come into contact with someone? Are they diabetic? Do they have a history of cancer? And then this determines whether they're eligible to come back to the office or not. And if they are eligible to come back to the office, and I think Dr. Kevin addressed this, there's a DOLE requirement for a daily declaration checklist of symptoms, right? Now, based on those symptoms, you may not be eligible and you may have to go back into a work from home or sick leave scenario. If you are eligible, you're gonna have to do a temperature check somewhere at the perimeter of the office. If that temperature check is high, you might have to do it again in a few minutes because maybe you just came in from a jeepney, right? If it's low, then you might be in a list to do rapid testing because some companies like this one is looking at segmenting certain groups of their population for rapid testing on a regular basis. And then it goes on and on. So the point is that this is a very complex checklist that that has to be done. And for a company like this with over 5,000 people every day. The way that this has been approached in the countries who've been successful has been with tech. So if you look at China, in the lower right-hand corner, the Chinese government implemented a widely distributed and used as mandatory stop lighting QR code system to determine whether you could access communal places or go to work or not, right? In Korea, it was the second country that has had a major impact in terms of being able to control COVID. Very strongly tech driven, lots of testing, an extreme amount of testing done in Korea, but also contact tracing at a very high level where all the telcos engage together to be able to contact trace literally everybody in the country and then send notifications out anytime anybody was positive. So they did these two things together, massive testing and then massive notifications, right? The point that I want to get across is if there's a commonality to success with COVID, it's been approaching it from a tech solution, and that's because it is a numbers game. It's a numbers problem, right? So the addressing COVID is a multivariable risk, and it requires some very significant technology to approach that. So our belief is that COVID risk management in the workplace does require some form of medical technology. Right, that's sort of the thesis that I want to go across. And I want to go back to the slide in terms of the complicated risk and break down how that could be approached. The first is a return to work checklist, right? So there's two ways of getting at who is at risk here in terms of the company from a pre-existing health condition. One is send out a form to screen all your employees and then map that to levels of risk, right? High, medium, or low based on pre-existing conditions. So one way is to do it self-reported. The other way is to do the equivalent of an annual physical exam and bring people in and do vitals metrics. Take a look at the body fat composition, take a look at their blood test for sugar issues like diabetic issues or heart health issues, right? The next is to perform a daily screen. And we know that some companies are trying to do this through forms, like paper forms. We're seeing some offices do paper forms. I don't think this is going to be very easy to manage on paper, especially not when you're dealing with a large company. We're proposing that daily screens should be automated and they should be electronic wherever possible. Also, in the new workplace, and I think for this foreseeable 6 to 8 months, we believe that sick leave is no longer a simple issue. If someone is sick, does that mean that they can work from home? Or does that mean that they cannot work from home because they're not feeling well enough for that? And what does that mean if they could work, but they can't come into the office, right? So there's a lot of issues that have to be tackled with, and for the larger companies, this is going to be a significant challenge. Then the next piece is the temperature screening, which we think is an important element. It's not foolproof, it's just one of many data points. But we believe that temperature checks have to be taken seriously and ideally digitally managed and combined back with the other forms of information so that you can get a holistic view of who can be in the office and who cannot be, right? And so to talk about testing, there's a couple forms of testing. There's testing for pre-existing conditions, right? Your typical blood test, your annual physical exam kind of information. And then there's testing for COVID antibodies or for actually having the COVID virus, right? And Josie touched on that, so I won't go into too much detail into that. But we believe that that's just another data point that ties to all the other data points. And this is integrated. All these pieces have to come together for companies to determine who can come in and who can stay out, right? Meaning that it's a combination of your pre-existing conditions to determine whether or not you can come to work. It is your daily screen and your temperature screen to determine whether or not you can come in. And then at some regularity, antibody testing. And I think, Josie shared her view on it. My view is that it's a data point and it's an important data point, because in the absence of other data points, it gives us more information and helps reduce that risk. But it certainly has to be considered in the context of everything else. And so just a final point on how to answer your question earlier, says how we, Zennya, do this. We built a tool for our own company because Zennya as a healthcare company has hundreds of workers that are going to be dealing with patients across all various risk factors. So we wanted to make sure that we could protect and monitor all of them as well as our customers. And we do that through an automated online screening. We do it through a QR coded red, green, and yellow stoplight sort of check that allows us to know and our customers to know who is fit to work. And then we have everything tied to a dashboard so that HR can manage everything. So our approach in dealing with the COVID issue is to wrap technology around all these data points so that we can look at the risk holistically and then try to minimize the risk of, number one, symptomatic people coming into the office. Number two, if that does happen, we want to protect those who are most at risk from a pre-existing health condition from being there. So for us, it's all about information and it's all about data and using technology to automate that. So, and I'll leave it there. That's where we'll stop the presentation.
No, thank you. I think this is pretty comprehensive, and I appreciate the very, I guess, pointed system that you guys are developing. I think a lot of people are going to reach out to you to ask if you can replicate this for their company. So be ready for questions from entrepreneurs. So I think on that note, right, I want to kind of just go through some of the questions that we're receiving connected to what you just presented, David, right? So I think one of the questions, and I see this in a lot of the forums here. Okay, guys, and this I threw to you, David, and to anyone who wants to answer. So earlier, Josie, you said that the most dangerous kind of people to be considered in this whole equation are the asymptomatic. So what do we do for those who, as you say, even David, if you have this wonderful tech, platform, what do you do with asymptomatic patients, right? How do we manage this? Like both on a getting them back to work and easing them into the transition of returning to work. How do we do that? Anyone can
ideally, we are testing, but of course, this is the way you will detect infectious asymptomatic people. But whether it's feasible, let's say Roche has 100,000 employees, multiply that by 8,000 pesos, right? Each test, and you never know when the person comes next day, if it's not infected again, right? So I think the best is really to understand whether a person has been exposed to, traveled, exposed, and to monitor on a daily basis, the symptoms. Well, you don't know because it's asymptomatic. It could be asymptomatic because it hasn't yet developed the symptoms, but it could be asymptomatic because it simply doesn't develop the symptoms. And antibody testing will tell you, okay, that person has been exposed, has developed immune response, is ready to go to work. So positive antibody tests will tell you, okay, this person is ready. So I think it's more about managing the risk with those people, because you really simply cannot test everyone on PCR. It's going to be very expensive for the company, and it's kind of, given the results are coming only after a few days, it's going to be also too late.
Okay. Maybe David or Kevin, you guys what is your strategy in dealing with asymptomatic people from your company?
Yeah, I agree with Josie. So it really depends. Like I said, it depends on the company's capacity. But if we're going to follow what's given to us by local health authorities, they would recommend like 2 to 4 weeks. This patient this person is not experiencing any symptoms. That's a sign that this person can be brought back to work already. CDC guidelines in the States would only quantify it to 7 days without any symptoms.
Right.
So they do those that interval, the time interval, to actually have enough time to measure the patient would develop disease.
Yeah.
Yep.
Okay. Thank you.
But in between, the person has to be quarantined to make sure that it's not exposed.
Okay.
Yeah, I think Josie talked about this, that there's two different kinds of asymptomatic. I mean, there's people that are currently carrying it that are asymptomatic, and I think that's where the testing comes in. You know, that's really the only way to look at it. And also from the information we have is people that are asymptomatic are not going to spread as easily, and also the number one form of spread really appears to be through breath, right? So wearing masks is going to continue to be critical, and there's no absolute way, but if you're monitoring, each of these things that you do, the testing, the screening for temperature, is just one form of reducing that risk a little bit. So I think there's no absolute. It's all about whittling it down so it's the smallest possible chance, and then you tap it off by hygiene and masks, right? So if everybody's wearing masks in the workplace and avoiding sort of face-to-face direct, contact, singing also, there's a study done on this. Basically aerosolizes. Like there was a case in the U.S. where something like an entire group of people between 65 and 80, almost all of them caught it because the singing really sort of like it sends that breath out. So avoiding anything, understanding the disease and avoiding anything which sort of propagates the spreading of it, and being aware of hygiene is also super important, I think.
Right. No, I mean, I think we are all learning to manage it and understanding. I think it's more of it's a step-by-step kind of analysis as to what we can do, right? And one of the questions here actually, and I'll point this also to you guys, one of the last ones for probably entertain. So specifically for Kevin, but anyone can jump in, right? So Kevin, you mentioned about disinfection booths used in other countries. How does that work? What is being used for disinfection? Is it safe to be used for workers here in our country? Or if not those booths, what can employers do on this kind of prevention or this kind of approach?
Yeah, so actually there's some makeshift booths being made by certain barangays here in the Philippines, and it just involves like a person, like a checkpoint, and then there's a person that has a face mask and a face shield, and they disinfect the person by spraying isopropyl alcohol on the people that are passing through. So some of them are more high tech. Where there's going to be a disinfectant mat that you step on, and then there's going to be a mist of disinfectant, some form of alcohol that you would pass through. So pretty much it's pretty straightforward, straight up disinfecting. And then some even have the thermo scanners that I talked about earlier. So it really depends on their capacity to build that. Yeah.
Okay. All right. And there's some question here. Thank you for that, Kevin. I think Can I just read it? David, maybe you want to answer, or many Filipinos in urban areas are tenants renting, and we tend to transfer locations. When they are tested, the health authorities can't seem to locate them for quarantine or isolation or treatment. My question is, will mass testing work in a country with the poor system of tracking and with a policy of privacy of results? Hence, info is limited only to health authorities who can't find their patients. Mouthful.
Yeah, that's a really good question. Actually, the problem of the health system in the Philippines, and I will point it out, is the way they manage information. So we really have poor coordination between LGUs, between areas of our country, and the reason for this is the fragmentation of healthcare. So pretty much each region or each province would have a different priority in terms of healthcare. So it's not really that unified. The information systems don't really communicate with each other. So that's a big flaw. And that's why they're having a hard time trying to screen people. And you could see it with, let's say, not COVID, like TB. TB alone has been in our country for the longest time. And it has taken the lives of a lot of people and still around, right?
And 4 years back.
Yeah, so that's a big issue that our health system needs to fix.
True. David.
Yes, it is a big issue, and I think that's why the private sector really needs to step in. And so there's been some efforts in this direction. So, for example, Project ARC and Joy Conception has really been focusing on, using the private sector to do mass testing with rapid antibody tests, and then get that data sent anonymously to the DOH. And what we mean by anonymously is that whoever gets the test and is a recipient of it, we're able to identify positives in terms of where they come from and where they live, right? Now, even in the case that people, we might not know where people are living because they're transient, if they're in the workforce, usually HR does know. And so Zennya also subscribes to something similar. Those who are using our healthcare platform for corporate health are also going to be following the same protocol, where whoever we identify as positive is going to be reported anonymously to the DOH so that we can identify hotspots. So the anonymous reporting is, you won't know the exact person, but if 50 people in a barangay suddenly pop up and positive, now we know that's an area we need to quarantine and send health workers and sort of So that's really the focus, is trying to be able to get that data from the testing that's done through the companies.
Right. Okay. And I think there's a question that I connects to that, David, if I can just connect it. Are there free apps that you recommend for the automated health monitoring of company employees?
Yeah, we're just unfortunate we're not aware of any free apps. I mean, and that's actually a big question, because there's monitoring. First of all, everything around COVID is very recent, and the approach that we took was based on the medical ID. With Zennya, we already had medical records and so on, so we built an approach that was based on that. We've seen there are some other apps that made independently, like not in a sort of company-wide way, but in a case-by-case person do sort of daily screens, but then that data doesn't go anywhere.
Right.
And then healthcare is a much broader issue than this. We think from a corporate standpoint that it really, we're hoping that this COVID pandemic incentivizes companies to take a much harder look at their employees, and they're going to have to, right? From a financial perspective, if you don't take care of their health, people can't work. And healthcare for the companies, for the corporates, is complex, right? It's about, and I mentioned earlier, vaccinations real briefly. The WHO is recommending vaccinations, and a lot of people ask me about this because they're not sure why. The 2020 flu shot is not a vaccine for COVID, but here's what happens: is the symptoms between the flu and COVID are very similar. Right? It's fever, temperature, it's coughing, and so now would be a very bad time to have the flu, right? Because
exactly.
I think a lot of people also misunderstand what the flu is. It's not a bad cold. Like the last time I personally had the flu, I was in bed for 6 days. So this would be a very bad time for you to have those kind of severe symptoms, not know whether or not you have COVID.
And just because you don't want to be in the hospital, right?
Correct, exactly. You want to avoid hospitalization. You want to avoid thinking that you could have COVID. So if you take the flu shot, it has a 60-70% chance of reducing your chances of getting the flu at all. Then that's one less thing to worry about. And from a corporate perspective, that's one less for them to worry about financially, because
Right.
if a section of their company does get the flu, now it's 14 days of quarantine and then testing and maybe PCR testing. It really creates a lot of cascading effects.
Ripple.
Yeah.
So I think I want to manage the conversation. I think we kind of need to wrap up. So just to kind of wrap up, and I'll give you each maybe 2 minutes to kind of do a wrap up. So if there's any last words that you want to leave to our audience, whether in relation to your topics that you mentioned or just in general precautionary measures to the people listening in. I'll start with you, Josie. Any last words to our wonderful audience and everybody who's listening?
Yeah, from our perspective is I think you need to watch really the quality of the tests. That's one message. Please do choose the best tests out there. It's not simple. You know, you're not never 100% sure that your workforce is gonna be safe and healthy. But when it's better to test than not to test, because you will know more about your people. And take proper actions. And of course, taking all the precautionary measures, symptoms checking and everything, this will help you to de-risk your workforce population and make sure that you have less exposure to COVID.
Thank you. Kevin, any last words?
Sure. I think my message would be to take ownership of your initiatives. Don't overly rely on, I guess, external sources and apply it to your company. You know your company best. You know your employees best. You know what they want. So you have to create something that's more catered to what you need. So and of course, you prioritize patient safety above all else. That's it for me.
Thank you so much. And David, final words, please.
Sure. So, you know, I think that the theme for my presentation was about risk management, and I need to look at this from several different perspectives of risk. You know, testing, a lot of people hyper-focus on just one area. Testing is important, but it's just a data point, right? Pre-existing health conditions is another very understanding how to manage the entire landscape of how to protect the employee group is important. And that requires a holistic approach. It requires as much automation as possible, however you find that. And I highly recommend to companies to take it seriously, to also look to external parties wherever possible for good advice. There's a number of companies that we know that are partnering either with us or others in the medical field to be able to provide some of those best practices and tailor fit it to their company. And again, I'm a big proponent of using tech and automation, not just because I'm a technologist, but also because I think that it's a very complex issue with a lot of things that can go wrong and a lot of numbers. If you're looking at companies that have several thousand people managing several thousand data points on a daily basis, it's really problematic. And just sort of to tie a knot on that one, just even around false positives, I think Josie put out some numbers in terms of false positives and false negatives before. If you're dealing with a rapid test that is 93% accurate under best case scenarios, right? And then you're dealing with providers that perform that test in not best case scenarios, you know, that number keeps going down. So that means out of 100 people in your organization, let's say 10 of them are incorrectly diagnosed, right? Now what happens? So this really requires a strong ability to manage by numbers. And for example, the way we handle that is we manage all that through the system. And then if the first test fails, we have another higher level test that we can do, like the Roche test that Josie mentioned earlier, which is a 99.5%, Josie? the much more
0.8.
Yes, 0.8. So the much more accurate lab test. So I mean, so you're saying that if the first test fails, then before you go to PCR test, we can do the next test and then the next test. And so really it's about finding a way to manage all this through some form of automation. And we have a solution, and we actually, to answer some of the questions earlier, we do have a solution that's available for companies that's a commercial solution. But if not ours, there are other solutions that you might look for or try to work within your own departments to come up with some form of automation. But don't rely on a paper process for this, because depending on the organizations, the last point here is that some organizations are at much greater risk than others. In our discussion with, for example, a manufacturing organization, all it takes is one outbreak to shut down the plant, and then there's massive losses.
Yeah.
Right. And so it's going to be very important, depending on your organization, to really assess risk well and spend money where you need to prevent that risk.
I think that was a perfect kind of end, kind of wrapping up of their statements, right? I think to everybody watching, this goes back to the core of why you started this business, and go back to what matters to you as a company. You know, we hope that it's the employees that you want to take care of, and that you invest in the things that will really take care of it. So thank you to our panelists and to everybody who joined. I am sure that they're going to be clamoring for more. So please stay tuned, because I'm sure this group right here will be following up on some webinars and some series and workshops. So thank you again to everybody. Josie,
Thank you.
David,
Thanks very
and
much.
Kevin. Thank you everybody for joining,
Thank
for
you.
being so engaging. And I will leave it to the team from Zennya to send out any information after this talk. Thank you so much. We have your
Thanks for inviting.